appreciate that everyone is here. Thank you for joining us at HIMSS. As healthcare systems grow more complex, the real challenge isn't just about adopting new technology, it's ensuring technology works together. Interoperability is no longer optional, it is foundational to operational success. And when we talk about interoperability, we're not just talking about data exchange between systems, we're talking about connecting people, clinical and non-clinical teams in ways that maintain security, compliance, and workflow efficiency while reducing cognitive burden on the care team. In many organizations, clinical communication platforms and enterprise collaboration platforms exist side by side, but they're not truly together. This separation can create friction, delays, and unnecessary work. The question becomes, how do we bridge that last mile between IT and clinical operations without disrupting the workflows clinicians rely on? That's where integration matters. By bringing Banyan and Microsoft Teams together, Mobile Heartbeat has helped create a unified communication ecosystem, one that allows clinical teams to stay within their specialized workflows while enabling non-clinical departments like IT, facilities, and administration to engage seamlessly with Microsoft Teams. This isn't about replacing systems, it's about connecting them securely, intelligently, and intentionally. Today, Jake will talk you through the real-world experience from an IT and collaboration perspective and how bridging this gap accelerated response times, improved care coordination, and strengthened cross-functional teamwork. Because at the end of the day, when communication flows freely and securely across the organization, everyone benefits, especially our patients. So again, I'm going to invite everyone to come on in. We have some empty seats. HIMSS is a long day, a lot of walking on your feet, so please feel free to come in and sit down, and I'm going to hand it over to Jake.
My name is Jake VanRoekel. I'm a senior system admin at Greeley. Can you guys all hear me okay? Okay, just want to make sure. So at Greeley, our mission is to provide excellent patient care for all. We want to make sure our vision is to be the best, and our values are quality, safety, and quality. What that means from an IT perspective, though, is that we want to make sure we're reducing friction and making solutions that actually matter and improve our clinicians' lives, but also that in turn will change the outcome of our patients, improving their lives. Before I get into the integration, I just want to quickly introduce Greeley. We are a 220-bed acute care facility in Ames, Iowa, home of Iowa State University. And we are a Malcolm Baldrige Quality Award recipient. And what that means is that we are continuously improving and focusing on how we can make sure that we are doing the best at everything, whether it's IT, HR workflows, all of the above, and clinical, of course. We are also a twice accredited magnet organization. So really what that means is we're always striving for nursing excellence. And from my perspective, what that really means is making sure that we are bringing the nurses and clinicians as close as possible to improving our workflows, letting them drive innovation, and asking them how to improve all of this. So that's truly key to our culture at Greeley. We live that day in and day out. So to dive into the integration, what tools are we using at Greeley? So for our knowledge workers, we're primarily M365. So that means Microsoft Teams. And then for our clinicians, they're using Mobile Heartbeat's platform, Banyan. And so in that scenario, we had some disjointed systems, right? We've got our knowledge workers who are loving M365, but they don't have a really great way to get in touch with our clinicians. And so this integration is a great opportunity to connect those two worlds and unify that experience for especially our knowledge workers, but on the other side of that, it also improves the experience of our clinicians because now they can more accurately, more often get in touch with, let's say, IT, for example, or HR, and that's a two-way road there. And so with both of these platforms, we didn't really have to worry about governance because we were already working on the same governance we've supported with both of these applications. And same thing from a security perspective. The other thing with this is our clinical workflows weren't going to be changing at all with this, right? Clinicians are going to interact with the platform exactly as they always have. The difference being that now they have more accessible options to get to other resources throughout the hospital. And additionally, no, we aren't really reducing cognitive burden on frontline users, but what we are doing is making everything more accessible for them. But what this integration did really prove an opportunity for is the operational efficiency across teams. So what does this integration actually do then, right? So in Banyan, if you get a notification, it will now appear right in Microsoft Teams activity. So you're getting a unified experience from the get-go. That means when you get a message, whether you got a pop-up from the Teams notification or it's up in the activity bar, when you click on either of those, it's immediately launching Banyan and signing you in, and then you're able to get deep linked right to that conversation. And so really it's making sure that knowledge workers who might be utilizing Banyan are immediately notified and in the know when they get a notification. The other thing is that this, again, really didn't change our clinicians, but it's improved the knowledge workers' experience. So from our clinicians' perspective, everything is the same. So as you can see here, in the Teams application, Banyan is listed right there as an app, and it's right there, easy to access, immediately available. So that's that unified experience. So when we talked about implementing this integration, we knew there was 3 key focuses that we needed to keep in mind. The first was, I'm obviously IT, so I was thinking, okay, how do I improve the help desk experience for our staff? And so for us, that was leaning in and letting the help desk be able to get more context on issues, right? When you get an IT ticket, 9 times out of 10, it's not going to have the information you need to solve the problem. And so what this really enables is us to get the important context when the clinician's available. We all know our clinicians are constantly busy, and so for them, they're not going to always be able to answer a phone. So this lets them respond in time when they are available. Additionally, this really helps coordination between departments. For example, our admissions team and the emergency department. Our admissions team is heavily using Microsoft Teams. However, they're also having to use Banyan because they're working with our clinicians. And so in this situation, it enables that admissions team to have a more unified experience and be more in touch with those clinicians while also still not changing these workflows. The other benefit that this provided to our knowledge workers is we're a hospital, we're 24/7. So from our perspective, it's hard to know when a clinician is working and to get in touch with them. The beauty with Banyan is that you know their status. So if they're available, they're online and working. And so it's much easier to track down clinicians, get in touch with them, and do provide them the resolution or communication that they're needing. So, and I know I've touched on this a couple times, but from the workflow perspective here, this was a really easy ask with clinical because they knew nothing was changing. And our adoption is going to be minimal. Adoption was, let me teach a user how to install a Microsoft Teams app. So that took literally 1 email. So when we talk about scale, we knew we needed to do a POC with a small subset. In this case, we targeted our help desk. But once we got through our POC, confirmed functionality, and got everything working, we immediately deployed this to all of our staff. So anyone at Greeley, if they've got a Microsoft Teams license, which all do, and if they have Banyan access, they're able to install this and take advantage of all these features. And through that implementation, we had to make sure we were keeping that feedback loop, right? That kind of goes back to Magnet, right? And our Baldur's Excellence Award, that we want to make sure we're staying in touch with our, not only our leaders, but our clinicians to make sure, is this actually effective? Did this help? And the feedback we got there was glowing. I've had many leaders who I didn't even have to ask for feedback. They reached out to me and said, whoa, this is amazing. And so, like, as I speak right now, we're the only production production environment with this integration. And so I'm excited to see other mobile parking customers hopefully implement this, but it's been amazing. So high overview, what changed, right? IT was able to provide faster outcomes and response to IT issues and improved communication. We've also made many interdepartmental communications significantly easier, and then we've also reduced that cognitive load for our knowledge workers. Closing thoughts right here is really, Mobile Heartbeat is an amazing partner. Without them, we weren't going to be able to innovate in this way. It's rare to find a vendor that is going to let you help figure out the image, right? They want to know what our feedback is. They want to be invested in that. And it's very hard to find that in a partnership. So I just want to say thank you guys for working with us and letting us be a beta facility for Banyan. It's been a great experience for not only me, but it's really helped Mary Greeley, and I hope it's helped other hospitals that also have Mobile Heartbeat. So if there's any questions, Kathleen and I will be here for questions. But thank you guys.